have Miss Julie Beem. She's the executive director of the Attachment and Trauma Network. She became a passionate and trauma-informing the world after adopting her youngest daughter who struggles with impacts of early abuse and neglect. ATN is a 25-year-old national nonprofit serving families and schools with trauma-informed support and education. Julie's been leading the organization since 2009. ATN's parenting organization has free online membership for parents of traumatized children. ATN's school program provides professional development training and a national conference which will be held in Atlanta in February 2020. Let me say that again. It will be held in Atlanta right here, February 2020.
There's cards over here too, so you can remind yourself on the way out.
Okay. Julie has a master's in business and undergraduate degree in education. Give her a hand, Julie.
Okay, so what if I told you that in addition to some of the things that Laura told you earlier about the prevention and the prevalence of addiction, that we have an underlying public health problem that is even more pervasive than that? How many of you have heard of the Adverse Childhood Experience Studies, ACEs? I'm so glad when people raise their hands. It is a study that we definitely in Georgia should know more and more about because it was done by one of our own through the CDC, Dr. Robert Anda and Dr. Vincent Folletti with Kaiser Permanente in California. And what they were trying to figure out initially was why people, women in particular, were resistant to weight loss. They had problems with obesity. What they discovered and ended up surveying 17,000 people in their initial study was that their early adversities had something to do with their ability to be able to lose weight. And then they started finding out through a series of questions, there are actual 10 factors. And I have brought and will leave for you an infographic about the basic ACE study. There are 10 factors, and they all fall into categories of abuse, neglect, household dysfunction, such as witnessing domestic violence or substance abuse. But what you will notice in the initial study is that they do not cover things like poverty or homelessness or gang violence or other community factors. But even without those, the initial ACEs study showed that 65% of our population has at least one ACE. And if you get to where you can say, yes, this happened to me as a child, to the tune of 4 or more ACEs, your risk factor for things such as substance abuse, being a domestic violence perpetrator, getting arrested, are significantly higher. But so are things like heart disease, stroke, obesity, COPD, a variety of physical things as well. So ACEs, and therefore by definition early childhood trauma, is not really a disease per se. It's not a disorder. You can't look it up in the DSM and go, okay, this is how we're going to treat it with drugs and all of these things. But it is a huge underlying risk factor for a variety of things, making it probably the nation's biggest public health crisis that we don't really even know is happening out there. That's not to say that everybody who abuses drugs or everybody who's overweight or everybody who has a heart attack had early childhood trauma. It's just to say that it's a bigger problem than we recognize. So I came to this work because I adopted a child from an international orphanage where she spent her first 2 years of life, and she'd been significantly neglected. They told me take her home and love her, and things would get better. They did, except she had a whole lot of behaviors that were just, there's no other way to put it, off the charts. She was aggressive and violent and self-injuring and things that could not be explained by any other disorder. So we hopped from doctor to doctor, looking for support. And when I found the families that were involved in the Attachment and Trauma Network, I started finding the answers. Finding that they knew what a lot of the professionals didn't, that her early childhood neglect and trauma were at the root of what was going on. As some of the others have alluded to, it really has a whole lot to do with that early childhood brain development. And what we often don't understand about what happens to our children early on in their brains is that it's really that the earlier is the more important. The idea that a small child that has no language does not remember something significantly traumatic happening to them is really, frankly, from my experience, a crock of, well, you know. It is, because their bodies remember. And it's even harder to resolve, to heal, to grow from some early event, or in many children's cases, chronic events, because we have children going home to poor situations all of the time, where maybe they are in a gang violence situation in their neighborhood. Maybe they're going home to an empty home. Maybe they're going home to a parent that does have an addiction problem that is sometimes there and supportive and sometimes not able to do that. And so their brains are learning that this is what normal is, that I have to survive on my own. And it's not even logical things that they can explain to you. So you say, well, what's going on? And they don't have the language to access what's going on. In our organization, we talk about that being that their thermostat is set differently than everybody else's thermostat, right? That they have, that their fight, flight, or freeze response is right at the tip of their brain all of the time, getting ready to flip. So from ATN's perspective, we think that this is the piece of knowledge that you really need to know is about the impact of ACEs. Our two main programs, one is to help parents, and it has been primarily the foster and adoptive community that have come to us for that help, to help them learn how to parent in a more trauma-informed, therapeutic way. The second program that started about 5 years ago that we're really happy about is the schools program. And we have parents who are also educators who have worked in their schools from administrative all the way down to classrooms to help teachers understand. Because what the research tells us about trauma is that it's anecdote. The solution for trauma is resilience and resilience building. And from ATN's standpoint, that's attachment building. That's a connection with one caring human being. So that one caring human being ideally is the initial primary caregiver, is the mom, the dad. But it's not always. We know that. We know how many children do not have that. But they can have the friend, the neighbor, the church member, the teacher, that really makes a difference for them, that makes a connection and builds a relationship. We hear it when we hear adults and teens talk about their struggles and how important it is to have the friends and the relationship. But it's biologically important, folks. I mean, it really is. The neuroscience is coming out around this. Dr. Bruce Perry at the Child Trauma Academy, Dr. Bessel Vanderkolt through the Trauma Center in Boston. Both of those are professionals who've done significant research that shows we're wired for connection. And that early connection and relationship has a whole lot to do with setting you up to be more resilient and able to bounce back from all those traumas. So, I don't know, that's really about all I have.